They shot a laser in my eye.
'Cause I've been living life right like I could just die any minute.
Hi, everybody. Okay, I wanted to start giving you more information about what's been happening with me since this is my new adventure, and there are things happening along my new adventure. I thought I would share a little bit about what happened to me yesterday. Just to give you some background, I have retinopathy. I have diabetic retinopathy. What that means is that there are blood vessels, extra blood vessels, growing on my retina. And it does happen with both eyes, yes, but right now it's happening with the right eye. And it's bad enough right now that I'm having trouble seeing out of my right eye. So I'm going to try and give you guys some background about what retinopathy is, or what the signs and symptoms of retinopathy are. Nearly all people with diabetes develop some degree of retinopathy, of retina damage, over several decades with the disease. Usually what this means is that if your diabetes is out of control, which mine was for quite a long while, that's on me. That's my fault. Yes. So what happens is that for many of us, the damage can only be detected by a retinal exam. And what that means is that yearly, if you're diabetic, yearly you have a series of pictures taken of your retina. And when you go in for an exam, usually it has no noticeable effect on your vision. Yeah. With me, it did. Over time, the progressive retinal damage may appear on the retinal exam. First with small bulges in the retinal blood vessels, and then larger abnormalities in the retinal vessels. Cotton wool spots in the vision, where it looks like you're looking through cotton. And then there's hemorrhages. Lipid deposits are called hard exudates, will be in the ocular fluid, and those are called floaters that you'll see from time to time. And abnormal looking retinal veins will appear on the back of the retina during your exam. Eventually, many progress to a stage where new blood vessels start to grow through the retina, or throughout the retina. These new vessels often break and bleed. Minor bleeding can cause dark floating spots, obstructing vision. Major bleeding can block your vision completely. I was not necessarily at the point of where my vision was blocked, but I actually watched the blood enter my ocular fluid, and I could watch it go across my eye. That was a little weird. So with that, I went in to have an exam done, and it was determined that I needed some help. I needed some assistance. So the next stage with me was I had to have an injection into my eye. And what that did is they put in some medicine into my eye to help stop the bleeding. So there was that. Let's see. Around half the people with diabetic retinopathy will develop a swelling in the macula called macular edema, which can begin at any time. I don't necessarily have the swelling. I don't necessarily have that. I have not been told that I have that. Let's put it that way. But that can cause even more problems. Let's see. If the swelling occurs near the center of the macula, it can cause vision disruption ranging from mildly blurred vision to severe loss of the center of an affected person's visual field. Left untreated, around 30% of those with such swelling experience vision disruption over the next 3 to 5 years. Macular edema is the most common cause of vision loss in people with diabetic retinopathy. I have not necessarily been told that I have that. I haven't really discussed that with my doctor, so that could be some of it. The repeated process of blood vessel growth, swelling, and scarring can eventually cause a retinal detachment. This is what was talked to me about and why I had the procedure I had, which manifests as a sudden appearance of a dark floating spots, flashes of light, or blurred vision. I have not had the flashes of light. I have not had the blurred vision, so I do not have a detached retina. And that's something that they looked at in my eye and found that I do not have a detached retina. Thank goodness. Enough scarring, though, on my retina could cause the detached retina, and that is another type of surgery that would be required later on, that they can take care of that with management of it. There are 4 common treatments for diabetic retinopathy: the anti-VEGF injections, which I've had, steroid injections, the pararetinal laser treatment, which I have had, and vitrectomy. That one is a different system, thing altogether. That is where they actually go in to your eye and they take out the fluid that has all the blood in it, and then they replace it with saline. So that's a different thing altogether, and that's something else. And I hope, cross my fingers, that's when all other options have been exhausted, that's where we go. So I don't want to have that. The current treatment regimens can prevent 90% of severe vision loss. So cross my fingers, we're on that path that I'm going to not lose any more of my vision. Cross my fingers. Although these treatments are very successful in slowing and stopping further vision loss, they do not cure diabetic retinopathy. Okay, that means what's done is done. The damage is there. Okay. Caution should be exercised in the treatment with laser surgery since it causes a loss of retinal tissue. It is often more prudent to inject the I can't even say that. Inject the medicine or inject the drugs. In some patients, it results in a marked increase of vision, especially if there is an edema of the macula. Okay, so that means that it can actually improve your vision in some patients. Okay, not in everybody. All right. In addition, standard treatment for diabetic retinopathy includes improved control of blood sugar, blood pressure, and blood cholesterol, all of which can reduce diabetic retinopathy progression. Okay, so a little background on me. I've got high cholesterol, I've got high blood pressure, and I've had issues with my blood sugar. I have noticed that over the last few months, last 6 to 8 months, my A1C has jumped. It went from about a 6.9 to a 7.9. The last A1C that I had, the last blood draw, found a result of my A1C at 7.0. And that's because I actually talked to my doctor and we got some drugs on board that actually helped drop my A1C. So there's that. Hooray. Now, the procedure I had, the laser photocoagulation. And what that means is they shot a laser into the back of my eye, onto my retina, and cauterized the blood vessels that are the issues. Laser photocoagulation can be used in 2 scenarios for the treatment of diabetic retinopathy. Firstly, to treat macular edema, and secondly, for treatment for the whole retina, for controlling neurovascularization. It is widely used for early stages of proliferative retinopathy. That's me. There are different types of lasers. There is evidence available on their benefits to treat the proliferative diabetic retinopathy. So it had been determined that I was a good candidate for this type of laser treatment, and that's what I had Friday. And I'll go into a little bit more on the process of what that was and my experience with that. For those with the proliferative or severe non-proliferative diabetic retinopathy, vision loss can be prevented by treatment with the panretinal laser photocoagulation. The goal is to create 1,600 to 2,000 burns in the retina with the hope of reducing the retina's oxygen demand and hence the possibility of ischemia. I can't pronounce that right. Essentially what it is it's done in multiple sittings. So what happens is it starves the retina for oxygen and stops those blood vessels from growing out of control. In treating advanced diabetic retinopathy, The burns are used to destroy the abnormal new blood vessels that form in the retina. This has been shown to reduce the risk of severe vision loss for the eyes and risk by 50%. Let's see. Before using the laser, the ophthalmologist dilates the pupil. That's what happened to me. We dilated my pupils. Applies the anesthetic drops, numbs my eyeball. In some cases, the doctor may also numb the area behind the eye to reduce discomfort. I did not have that happen. The reason is because the type of laser that was used did not necessarily cause that much pain, but I'll tell you, it did hurt a little bit. It is, my eye was sensitive to it, and it was sort of like an ice cream headache, that ice cream cold headache that you get, but it was only on one side of my face, and it was usually right about here that it started to ache. The patient sits facing the laser machine or facing the doctor. He actually had a handheld laser, so that was kind of cool. While the doctor holds a special lens on the eye, the physician can use a single spot laser, a pattern laser, or two-dimension patterns such as squares or rings or arcs or whatever. I believe, I can't remember exactly what I saw, but I thought I saw little octagons all over the place. So that was kind of weird. Or a navigate laser, which works by tracing the retinal eye movements in real time. During the procedure, the patient will see flashes of light. Oh, yes, you do. And it's bright, bright, bright light. These flashes often create an uncomfortable stinging sensation for the patient. Yes, it did. After the laser treatment, the patient should be advised not to drive for a few hours while the pupils are still dilated. Luckily, Chris was able to take me and drive me to and from the appointment. So there we are. Vision will most likely remain blurry for the rest of the day, which it did. I was having issues with my right eye. Though there should not be much pain in the eye itself, an ice cream headache, like pain, may last for hours afterwards. It did, but it started to fade pretty quickly. By the time I went to bed, I wasn't having any issues. I did take some Tylenol, though, later in the day. The medications, when they give me the injections, I'm not even going to try to pronounce a lot of these. There's a long-acting steroid preparation, a treatment with people with DME, with intravascular injections I can't even pronounce that. May lead to some degree of improvement in visual acuity when compared to eyes treated with the placebo injections. We didn't have that happen. When injected in the vitreous cavity, the steroid decreases the macular edema, thickening of the retina, and the macula, caused due to diabetic maculopathy. That's a different thing altogether. That's that swelling of the macula that we talked about. And that may result in an increase of visual acuity. The effect of the drug is not permanent and may last up to 3 months, which necessitates the repeated injections for maintaining the beneficial effect. Best results of the intravicular drug have been found in eyes that have already undergone the cataract surgery. I do not have cataracts. I have the possibility for cataracts, but I do not have cataracts. Thank goodness. Complications of the intravitreal injection may include cataract, steroid-induced glaucoma, and I can't even pronounce that last one, and I don't know. So do your own research on that. I'll highlight it here so you guys can read it. The intravitreal anti-VEGF, that is the drug that I've had. It may have advantages in improving visual outcomes over the... good grief, a lot of long words that I don't know. Improving visual outcomes. After a year, long-term advantages are unclear. So the studies haven't been too conclusive on that. In case of the vitreous hemorrhage, however, anti-VEGF injections proved to be less effective in restoring visual acuity than the vitrectomy, combined with the pan-retinal laser photocoagulation. So that's something else. That's that surgery that I was talking about when they take out the fluid of the eye and replace it with saline and then zap your eye and cauterize everything. And yeah. Anyway, let's see this last bit here, the surgery. This is if nothing else works, this is where I go. Okay. Instead of laser surgery, some people require a vitrectomy to restore vision. A vitrectomy is performed when there is a lot of blood in the vitreous or in your ocular fluid. It involves removing the cloudy vitreous and replacing it with saline solution. So they take out your eye fluid and replace it with the saline. Studies show that people who have had the vitrectomy soon after a large hemorrhage are more likely to protect their vision than someone who waits to have the operation. Early vitrectomy is essentially effective in people with insulin-dependent diabetes. I'm not insulin-dependent. Okay, so there's that. Who may be at greater risk of blindness from a hemorrhage into the eye. Vitrectomy may be done under general or local anesthesia. The doctor makes a tiny incision in the sclera or the white of the eye. Next, a small instrument is placed into the eye to remove the vitreous and insert the saline solution into the eye. Like I said, this is the last result. This is the end. This would be the final option if nothing else works. Let's see. Patients may be able to return home soon after the vitrectomy, or may be asked to stay in the hospital overnight just for observation. After the operation, the eye will be red and sensitive. Yep. Patients who usually need to wear an eye patch for a few days or weeks to protect the eye. Medicated eye drops are also prescribed to protect the eye against infection. There's evidence which suggests that anti-VEGF drugs given either prior to or during the vitrectomy may reduce the risk of posterior vitreous cavity hemorrhaging. So it may prevent bleeding into the eye. Vitrectomy is frequently combined with other modalities of treatment. And here's my experience. I went to the doctor, and after my retina scans, they determined that I needed to have the injection, the anti-VEGF drug, into my right eye. There was a lot of blood in there, and there was some hemorrhaging going on my retina. So we needed to stop that as fast as we possibly could. So beginning of August, I had that done. Around like August 6th or something like that. A few weeks, about 6 weeks after that, I was referred over to the retinal consultation. So I went to another ophthalmologist, and we determined that I needed to have an injection again because there was still just too much blood to see what was going on with my retina. Exactly. So the doctor prescribed yet another injection, so I had that. And then I was scheduled for another appointment, which was yesterday, Friday. And I had my first laser treatment done. What they did then is they numbed up my eye, dilated my eye, and then I sat in the chair and I watched the light show. And it was pretty darn spectacular. It was bright. It was at times blinding. Yeah, I couldn't see anything after the treatment was done. I did feel the sting. I did feel that sensitivity. It did hurt. I also had a little bit of a headache after everything was all said and done. And apparently he was able to get things done in about 25 minutes. So it was relatively quick. So here's a picture basically of what happened where they shot the laser into my eye. I am due to go back for an injection to for another anti-VEGF treatment, and then they're going to determine after that when I will have my next laser treatment. And yes, this will be the laser treatment part 2, and hopefully, cross my fingers, that will be the end of it. So essentially what I did is I joked with my doctor after everything was said and done that, yeah, I've lost a quarter of my left leg, and now I'm losing vision in my right eye. And essentially, I'm turning into a pirate.
Yo ho, a pirate's life for me.
There is what's been going on with me. That's pretty much it. That's pretty much everything that I've got to tell you about what happened. I'm hoping that everything will progress to a point where I'm not going to lose vision in my right eye. I'm going to be watching very carefully about what's been happening with my left eye. I haven't seen anything happen yet, but there is a possibility that it may. So we can hopefully stave off anything that'll happen later and sort of end all this. But I thought I would just let you all know what's happening, because it's another part of my adventure. This is my new adventure. This is the things that are happening with me that are new, and I wanted to share that. I mean, it's, since this channel is Chuck's new adventure, here we are. This is part of it. Anyway, thanks for tuning in. Thanks for watching. Don't forget to hit that like. Don't forget to hit that subscribe button. And don't forget to hit the notification bell. That way, when you hit the notification bell, you are updated every time when something new pops up on my channel. And again, thank you very much for joining me. Thank you for my followers. I truly, truly appreciate you. Thank you for all my subscribers. I truly, truly appreciate you. And I'm hoping to generate some new content pretty much in the future. Well, in fact, tomorrow, Chris and I will be in the studio, and we're going to be talking about skiing in Colorado. Well, Chris will be talking about it. I'll be listening. Anyway, again, thanks for joining me, and I'll see you all real soon. Okay? Bye.